Wonderful sound technician. Good afternoon, everyone. I hope you're enjoying your conference so far. My name is Robert Eade. I'm Head of Health and Social Care here at Policy Exchange, and we are really delighted to be hosting this fringe event this afternoon in partnership with the Health Foundation, and the title is Are Good Jobs the Secret to Good Health? I'm going to introduce our excellent panel in a moment, but I just want to start with three facts that perhaps just sets a little bit of the context. So, the UK is the only country in the developed world where there has been a continued rise in the number of people of working age who are inactive in the job market. Obviously, every economy struggled during COVID, but we are the only country. Places like Turkey, the Netherlands, Sweden, different types of economy have all bounced back. So what's going wrong in the UK? Why are we such an outlier? The next one is that roughly 500,000 Britons aged 15 to 64 are missing from the workforce, and many of them cite long-term illness as a key driver of that. And then the last point that I would add is the percentage of those not in education, employment or training due to health has been rising, and that is 2/3 of that volume is due to one condition, which is poor mental health. So to discuss with our panel, which I will now introduce. So immediately on my right-hand side, we have Victoria Prentis, who is the newly appointed Minister of State within DWP and has been the MP for North Oxfordshire since 2015. On her right-hand side, we have Joe Bibby, who is Director of Health at the Health Foundation. To my left, we have Sarah O'Connor, who is columnist, reporter and Associate Editor for the Financial Times, and then to my far left we have Jordan Cummings, who is the Director of Health, is the Programme Director for Health at the Confederation for British Industry. I'm going to have 3 minutes, punchy opening statements, and then bring you guys in for questions. So I will now hand over to the Minister.
So the question is, are good jobs the secret to good health? And the very punchy answer is yes. Very often. We know that jobs can reverse the adverse effects of unemployment. We know that they meet psychological needs, and we know that people like being part of the workforce. This is a normal thing for people to do. And we know that jobs can be a really important part of your identity, and particularly for young people, your social life, frankly. We know that unemployment is associated with less good mental health, with long-term illness, with less good cardiovascular disease. And we know that social isolation and lack of self-esteem can follow from unemployment. So, what do we do about it? There are some things that we're doing, and I'm very happy to go into those further as we progress. But we have in DWP, in the Department of Health and Social Care, a joint unit which was established in 2015, which focuses on how to do the cross-government working, which is really key to getting this bunch of people back into work. There is clearly more work to do there. We know that occupational health, now those are possibly not words that are spoken often at a Conservative conference, but they should be, can really help. Only about 50% of employees and 1 in 10 of the self-employed, which are a growing group after COVID, have access to occupational health. And we know that there are clinical capacity shortages. So we are, as a government, promoting occupational health. We're testing at the moment a financial incentive for small businesses and the self-employed, large group, and we're providing a fund to stimulate innovation in the OH market. We did the Health is Everyone's Business consultation, which others may want to talk about, published a government response way before I got there last year, mid last year, and we now need to move to enact the recommendations that we accepted from that report, so to work on greater clarities about employee and employer rights and responsibilities, and indeed access to occupational health. I think this is part of a much wider conversation about a group which I really don't like calling inactive, but often people do describe as economically inactive, and the general push to get people back into work.
Thank you very much, Minister. Just one follow-up question. Obviously, you referenced the Green Paper. That work was started before the pandemic, and I believe the response came sort of in the middle of the pandemic. Do we need to look at that again, given that the problems clearly have been amplified massively over the last 2 years?
Yeah, we obviously need to continue to deal with the labour market we've got. I think very few of us would have anticipated where we are with the jobs market. I think the great fear at the beginning of the pandemic was that people would lose their jobs and there would be a lot of unemployment. Now we find ourselves in a really tight labour market, which brings its own challenges, but with a lot of people who've simply decided not to be part of that for whatever reason, and we need to interrogate very up-to-date figures as to why. And in fact, I'm off to a job centre next to do just that.
Thank you. Joe.
Great, thank you. So I think there's a risk we're all going to start by just agreeing with the question that's been set out. So yes, certainly good jobs are really important to good health. I thought I'd just try and unpack that a little bit. And I think the first thing is to think about, well, what makes a good job? What makes good work? And there's several aspects of that. I mean, there's obviously the sort of traditional health and safety executive lens of good work. So making sure there aren't hazards at work, there's good working conditions, workers can go to work and feel safe. And that's a kind of minimum and something that I think, we've clearly done very well in this country. I think the second thing around good jobs and good work is that they provided adequate income. And I think this is one of the areas that is challenging. And when we talk about an adequate income, it's not just about an hourly rate. So it's great that we have a living wage in this country, but actually what we need is a living income. So if people can't actually earn enough over a week, over a month, to provide the means that they need to live well, then that's going to be detrimental to their health. There are other things, though, that when we've done analysis at the Health Foundation, we've identified as some of those softer factors around jobs that contribute to good health. So, for instance, having control and autonomy in the workplace, really important things for people's well-being and ultimately their health. And that's things around control over your shift patterns. It's having breaks, having clarity of responsibilities. Line management and the quality of line management is often found to be one of the single most important things in creating good quality work. So these are all other aspects of the job. We also find that the opportunity for progression in the workplace is important to people's health. And actually that's another area where we're not doing that well. Analysis of labour force statistics showed that a quarter of the employees who were in low quality work in 2013 were still in low quality work 6 years later. So that's not suggesting that there's movement and progression at the level that we would want to see. All of these things take a toll on people's good health. So the next question is, why is good work good for your health? And we've heard some of that really. It's about the income, it's about the sense of purpose, the self-esteem, and so on. But I think the other thing we need to look at in this conversation is that it's not just about good work being good for health. Good health is critical for being in the workplace, and it's critical to the sort of productivity challenge that we have in the UK. And unemployed people are 5 times more likely to have poor health, and poor health is one of the factors why people are leaving the workforce or not getting into it in the first place. So I think what we really need to have here is we need to make sure we're maintaining and improving job protections. If we want people to stay healthy and productive for longer, we need to be providing good quality work in this country. We need to have investments in programs that will help people get back into the workplace after a period of long-term sick, or actually, given issues around mental health in this country, helping people get into the workplace in the first place. And then finally, I think if employers want to stay competitive, they have to have strategies to help people stay in work for longer, even when they start to experience poor health.
Thanks, Joe. And just one follow-up. In terms of the government and the state's role in enabling good quality jobs, what are they getting right at the moment, and where does we need to have more concerted focus, do you think?
So, well, I think, we do have some good protections in this country. If you compare globally, we know actually a lot of those protections were things that were tied into wider EU policy. We're hearing about government talking about drawing back on some of those policies. I mean, that, quite frankly, that just really would be shooting ourselves in the foot. We're already hearing about people leaving the workplace because of poor health. If we make working conditions harder for people, that's really not going to help us in the long run. But it comes down to, pay, certainty around work, the right number of hours so that people have a living income, sickness protections. I mean, we saw the challenges of not having good sick pay during the pandemic, where people in certain roles weren't able to take time off sick, and that was worse for all of us because it increased infections rate. So we need good sick pay, we need holiday pay, all of those things that a lot of it we take for granted at the moment, but it's not evenly distributed across all sectors of our society.
We might want to pick up on the statutory sick pay point, because I know in the consultation response, the government said that they thought that increasing statutory sick pay would be an extra cost on businesses during a period where there's a lot of strain and extra costs that they had to bear through the pandemic. So, but ultimately, poor health is costing businesses bottom line, which takes me nicely to Jordan. It'd be great to hear your perspective from the CBI.
Thanks for having us. So the CBI represent about a third of the private sector. So we are very enmeshed in what is a cost and isn't a cost for business across the economy. The question is, are good jobs the secret to good health? Well, the answer is yes. I don't think it's that much of a secret, in fact. And if we're being really honest, we desperately need them to be, because if they're not, society's really going to struggle with the downstream pressures that we've already got in the health system. So if we think about why this is important, I guess, for employers, something rare happened in the pandemic. Trust in business actually went up, and I've been doing this long enough to know that that doesn't happen hugely lightly. And it went up because that line between employers and employees was shrunk for the first time for lots of businesses. The decisions that firms made every day had direct impacts on the outcomes, the health outcomes of their staff. And that means we're in a really different space now when it comes to industry. We've got this kind of, hopefully, post the immediacy of the pandemic window to make some really seismic changes. And so why this is important for firms up and down the country, as Joe said, we should be seeing this as a source of competitive advantage. Offering a fantastic job with a fantastic wage, a great benefits package and flexibility, whether that's hybrid working, time off for carers leave, whatever it may be. Don't see that as a cost if you're an employer. That is a huge selling point, and people are really, really out for that. So we want to see the conversation move in terms of health being less of a cost, more of a proactive investment from an employer's perspective. And then if we just think about what's happening in the labour market, as we've spoken, there's lots of inactivity out there. But also there's a growing issue with people in their kind of 50s, especially among males, being too ill to work as the state retirement age continues to rise. This is going to be a growing challenge. And so healthy life expectancy is obviously what governments go after, and they should go after. I'd quite like to be older before I die, that's fantastic. But I'd also quite like to have a longer, more productive working span. So your working life expectancy should be viewed just as importantly as your healthy life expectancy. And that's something that we'll be looking at the CBI. So where are firms kind of able to pull levers in that middle 40 years that we've all got, when government are taking care of us at the bottom and at the top? Where can they kind of do more in that period of your life where they see you perhaps more than your local GP sees you? We go to work 10 hours a day, probably a lot of us at least. And so where can firms kind of do stuff for you in that middle 40 years? So we're thinking a lot about healthy working life expectancy and how we can stretch that out. So for us, I think are good jobs the secret? Yes, they are. We desperately need them to be. Otherwise, the pressure in the NHS is going to get worse. We need to start looking at it as a source of competitive advantage, and we need to start thinking about that middle 40 years where businesses has maybe more levers to pull than the state has.
Great, thank you, Jordan. Sarah.
Thank you. Thanks for having me. So I work at the FT, which means I like numbers, so I'll give you a few, hopefully not too many. I thought it would be helpful to think about how we got here, and then some good news and some bad news about what happens next. So how we got here. We're talking today about inactivity. I agree with you. I don't really like that word either, but we'll stick with it for the sake of simplicity. So inactivity is people who are neither working nor actively looking for work. Actually, in the decade until the pandemic, inactivity was falling. So Britain was becoming a more industrious country. The inactivity rate fell from 23% to 20% between 2009 and 2019. And so on the eve of the pandemic, inactivity was the lowest since the 1970s. Also during that decade, people were working longer hours than we might have expected. There'd been this long, steady decline in people's average working hours. That sort of plateaued and maybe even inched up a bit. What was going on? Why were we all working more? Maybe we like work, maybe work, I think, in some ways was getting better for lots of people. There was also a negative reason, which is that, as everyone knows, the last decade was dreadful for pay. So real wages basically stagnated for a decade. So people needed to work more in order to sustain their living standards. So we came into the pandemic, with a lot of people working who hadn't been working previously. And a lot of those people were already saying that they weren't well. So ill health had been rising during that period, but people were still managing to kind of keep working. After the pandemic, we've had a big break. So a lot of people who had been struggling but had been keeping going have just left the workforce altogether. So that's about 640,000 people have left the labour market altogether since the pandemic, and 55% of those say it's because they're now not well enough to go to work. So what's the good news? The good news is that the ONS did a really interesting survey. It was only published a week or two ago, where they asked those specific people, the ones we're talking about now, who are in their 50s and 60s, who left the world of work during the pandemic. They said, do you want to go back? And actually, for those in their 50s, 72% of them said, yes, I would like to go back, actually. So, there's an opportunity there. There are lots of people who do want to get back into the labour market if circumstances could be right for them. The ONS also asked, what kind of job would you need to have in order to want to go back? And the three things that they said would be most important would be flexible hours, good level of pay, and the opportunity to work from home. So work from home, that's good. We've all started to do that more anyway, so that feels a bit more possible. The other things, this goes to what Joe was saying. Flexible hours, good pay, those things are present in good jobs, well-paid jobs. They're often not present in bad jobs, low-paid jobs. There are a lot of people who don't really have access to those sorts of jobs, and so they're the ones that I think are going to struggle to get back into the labour market particularly. So people on lower incomes who don't necessarily have university degrees, I think they're the ones who, you might be looking at, say, a job in an Amazon warehouse. The pay is not terrible, but it's not great. Certainly the working hours are not particularly flexible. There's a lot of zero-hours contracts in certain sectors of the economy. So all of that means that we have a kind of mismatch there between the sorts of jobs that people need and the sorts of jobs that might be available to them. Now, other little bits of bad news. Sorry about this. A fifth of those people said that they're currently on an NHS waiting list for treatment. So I think for me, this is a sign that, the NHS is not just a cost to our economy. It's actually, at the minute, because it's been underfunded and it's struggling, it's a barrier to growth. So if we want the economy to grow, if we want the employment rate to rise, we need to get people the treatment that they need. People are, I'm sure we all know people ourselves who are in this position. My father-in-law has been waiting 3 years for a knee replacement, and every day his mobility gets worse. And there comes a point where even if you get the treatment, you've kind of lost the ability to do the things you used to be able to do. So, funding the NHS properly so that we can kind of get the labour market moving would be a really good thing. The other thing I would say is that government policy so far has felt a bit off target to me. So a week or two ago in the mini-budget, it was announced that for the 50s and over, there would be more support for those ones who are unemployed. So more support for people who are currently going in and out of the job centre. They'll get more meetings. That's all great. I don't think there's anything wrong with that. But that's almost as if, you look at the target, you turn 90 degrees, and then you fire the arrow. Because unemployed people in their 50s and 60s are not the problem here. The ones who are actively looking for jobs. The unemployment rate for that age group is only 2.6%. It's at a record low. The inactivity rate, the people who aren't looking for jobs, the people who aren't going to the job centres, who are possibly not on benefits, very probably not on benefits, that's 27.7%. So that's the group that we really need to target policy on, and it's a much harder group to reach. But if we don't start trying to do that, then I think we'll really struggle. And I'll leave it there. That's probably more than 3 minutes, sorry.
That's excellent. It's given a lot of food for thought. Actually, I'm going to pick up on that last point around thinking about those who have chosen to leave the job market and what it's going to take to coax them back, and quite compelled by the statistic that half of those sort of over 50 exiters would be persuaded to work again. Victoria, what is the strategy? Is that on your radar? Are you thinking about this? I appreciate it's an early stage into your brief, though.
No, don't worry. The one thing that I've fallen out with my Secretary of State about is that I dislike this group being referred to as older workers. In my view, we're in the prime of our careers, over 50 workforce. So I insist that the department refers to us as the over 50s rather than any other language. But absolutely, they are front and centre, and the arrow is pointing both ways. It's just we have limited, as you acknowledged, ability to reach those that we can't reach directly through the job coaches who are doing a fantastic job. One way, so there are two basic, if we strip everything back, ways to encourage these people to stay in work, actually, just not to leave it would be a start, and then slowly, we hope, encourage everybody else back. One is by working with employers to create flexible jobs, and that is not just working at home jobs. That is flexible in every sense. So it might be working around the bus timetable, or it might be allowing time, morning a week to look after the grandchild if that's the deal, or it might be jobs that allow some home working, or it might be a different approach to shift working. I mean, often shift working is very flexible, in fact, and people in the care sector, often that age group, do very well with shift working because it fits around other responsibilities. The other side of the tools we have available to us is working with this age group, and I agree this is a conversation that ought to start at birth, but it often doesn't, to understand what their pension will really look like. So as a group of, as a race of human beings, we're very bad at assessing risk and very bad at working out what money we will really need when we retire. Very bad. And we've got something on the government website called the Midlife MOT. It's great insofar as it is, but really we're so bad at this that it would be much better if we could be talked through it, possibly by our employer or by another source which we're working to identify, to really sit down with people and say, look, if you don't work for these extra 10, 20 years, your retirement when you're 86 will look like this, and you don't want that. So twin-pronged. Yeah.
Joe, I wanted to pick up on one thing that we've talked about. There's clearly lots of interfaces here between different agencies, different Whitehall departments, and then, of course, with business. How can we sort of best galvanise action in this area? Because it's almost a challenge, a bit like climate change, where you have to approach it from so many different ways. And is there a solution within our grasp in Whitehall, or do we need a different kind of steering group or organisation to sort of put rocket boosters under it?
Yeah. No, I think, all the evidence would tell you that if you want to improve health and have people stay healthy for longer, stay in work for longer, you need a sort of whole government strategy. Every part of government, the decisions it makes, has implications for our health. Now, I think Boris Johnson set up a health promotion task force that was a whole cross-government representation, ministers looking at the different contributions that their departments made to health. I don't know what is going to be happening with that, but that's the sort of mechanism that is needed if it's going to really think about the health impacts. I think the joint department that sits between DWP and the Department of Health and Social Care, that's been in place for probably a decade now, I think is another good example of actually bringing together ministers and civil servants to think about joined up policies and the impact that they have. But I think it comes back to every government decision. And I mean, on the there was just one thing I wanted to pick up on Sarah talking about the need to invest in the NHS to help people kind of get the care they need in order to get back to work. I think one of the areas we need to think about there is mental health. We said at the beginning, poor mental health is one of the biggest reasons people are leaving work on health grounds, but it's one of the areas of the NHS we underinvest in. And particularly from a prevention point of view, there's really not the investment there. So I think these are the kinds of conversations that need to be happening across government to really start joining the dots between different bits of policy.
That's great. Jordan, I know, just to pick up on the mental health point, I know that mental health and MSK are the sort of two big areas which tend to contribute towards work-related sickness. Are the solutions available and we're just not embedding them? consistently enough, or do we need to have new innovation in OH services for businesses? And are some businesses doing this really well and knocking it out the park? And how can we learn from them? Because you must have members that are really leading the way.
So some businesses are knocking it out of the park. They usually obviously tend to be the bigger businesses, more resource. They have teams to look at this stuff. So obviously the vast majority of businesses in the country are small businesses who don't have an HR director, definitely don't have someone just to look at OC Health as a service. So the managing director is probably also the HR director and the sales director and everything else. So for most firms, this is hard to do. And so the work that DWP have been doing on the advice service and everything else is really, really fantastic. And we really encourage it. In terms of the OC Health point that Victoria raised, I think that is bang on. This has been really underinvested in by industry. I think we can openly say that for quite some time. So that will need some kind of rapid transformation. I think underpinning a lot of this is getting firms to think, I need to do this because it's for the good, yes, of my workforce, but it's for the good of the UK's resilience of the workforce. So when you mentioned the climate analogy, I think that is the perfect analogy to be taking. Big, seismic, intractable challenge. How do we fix it 7 or 8 years ago? Well, we set business off and we set them with challenge funds and innovation frameworks and everything else, and they come back with solutions. We wouldn't reach net zero without them. We really need that in health. We need to be setting a framework within which we say the state can't solve this on its own. Business, please go away and innovate for new ways to do this, new types of policy, new practices within the workforce. And so I think we do need that kind of framework and that North Star to work to, get everyone galvanised behind a target. The firms that do this exceptionally well that don't have money are the firms that are really fantastic at employee consultation. So most firms will do something about the health of their workforce when someone's got a problem. So, I've suddenly got a broken leg, I can't get into my local GP surgery, I'm going to need some kind of support based on my workforce setting. Firms that are doing it exceptionally well are already thinking about that before that person gets a broken leg because they've done lots of consultation with their employees over several years. And so they've adapted a policy that can flex to the potential needs that might come up. So I think the proactivity point is what gets people out of the trap of only procuring OC Health or whatever it might be when someone's already in crisis. And the best example of that is also mental health. By the time you need to see a mental health first aider, sometimes you're probably already in crisis. So proactivity is the way out of it.
I'm going to give the Minister a chance to respond, but I want to ask a supplementary question as well. Is climate change is a political judgment point as well. There's a consensus now, but it relies on leadership to say that this is a priority and I will pursue it. Obviously, we have a new Prime Minister, a new Chancellor. To what extent do you think they're bought into this good jobs agenda and the link with health? Do you think they get it?
Okay, well, I'm going to send you all off to answer that last point to look at the main stage. And you look in front of you and you look to the sides and there's two matching panels up there and you can come back and tell me what's on them. It's written up there very loud and clear that this is absolutely central to the government's policies and to the growth agenda. I was just going to come back quickly. I had 2 really good round tables with businesses, wide variety of businesses, actually including Amazon, last week on this very issue and how their flexibility and their good employment practices can make a difference. And of course, we should always use the opportunities that are presented to us. We have a very tight labour market at the moment that has made employers concentrate on the fact that they really need to be courting their employees and encouraging people into work. And they were really willing to engage with us, particularly, very obviously, in the sectors that have the tightest problems.
Great. I'm keen to start bringing in some questions from the audience. So can we just have a show of hands to see how much appetite there is? That's great. Okay, we've got 4 hands. So actually, I'll take all 4 together, if possible. So, maybe we'll take 5 then. Could I just request that you make your questions short, please? So just a couple of sentences. Can we start with the lady down here, please? Thanks, Lottie. Did you have your hand raised? And if you could introduce yourself.
Yes, hi, my name is Laura Evans. And I was a little late, which I'm apologising for. But the conversation, I run a small business myself, so a lot of this we don't see, but we have to keep our people happy. So I've done healthcare, and we're really interested in their families, and we've had a few crises that we've dealt with. The main thing about this whole thing is the word retirement. If we could take that out, because actually we stopped retiring a long time ago, because I have no intention of retiring, and I'm 54. Okay, I'm 55. I keep lying just to get myself happy. But I'm going backwards every year. But yes, so my point about it is that it's the language around it that is wrong. The second point, who wants to retire? I mean, what are you going to do all day for the next 30 years? How are we going to afford it? So I think there's a seismic shift in people's thoughts. And I also think that the government have a lot to play in that by the idea that if you signposted me to more evidence about what I could talk to my employees about, but you know why you don't talk to your employees? It's very simple, because you might get it wrong and you don't know where you're going to be in some sort of line down the line. The moment you say, look, you're getting older, is that discriminative? Is that a problem? You've got children, is that then going to lead me down another path? There's a whole load of things why we are a little trepidatious about saying anything. Thank you.
Thanks a lot. Just keep your hands up. Sorry, so we had a gentleman here. Sorry, we'll try and bring you in afterwards, and then we'll just work our way across.
James Clifford. I'm Deputy Chairman Political of East Ham, and I suffer with mental health problems and that. And the
Could you
biggest,
bring your
the biggest problem I had with my mental health was the local authorities. Is a lot of them keep you hostage because the only way they can collect grants and premiums in these disabled names is by being on welfare. And that's the biggest problem because, no offence, then they hold them thinking you can't get medication, you can't do nothing. Got to a point where I had to deregister myself from the services in my area because they wouldn't let me do nothing. They kept harassing me and all this just so they can get money. And I only ever got two hours a year. And to me, that was diabolical. And I had to make a choice of them or me. And I chose me. And at the moment, I'm here representing mental health because, you know, I am a mental health activist. I'm a campaigner for mental health. And that's the biggest problem with people unemployment is local authorities because that's where services start in that. Because I'm from a Labour-held area and they hold us hostage. They literally won't let us do nothing. You literally, if you're not there...
Thanks. So I'm keen to get some other questions in, if that's okay. So
local authorities need to be looked at first.
The interface with local authorities and funding. Thank you very much. And if we just go across, we've got a gentleman at the back of that row with glasses, and then we'll come to the front too.
Thank you. Good afternoon. Lee Wright from Reading Partnership. We're one of the organisations that works with DWP actually to provide employment support, helping people back into the workplace. Firstly, just to agree with a lot of the points that have been mentioned there, and I think your point, Sarah, was particularly key, that so many in this group are actually willing and really quite keen to get back into work. And from our experience of dealing with people who come through Job Centre Plus, the real key to that is making sure that everything is personalised and designed to the needs of the individual. And I think that is one risk in this debate, that over 50s become a bit of a catch-all term, when there's actually a real kind of complex web of different needs that people need, be they health interventions or just, frankly, an injection of confidence to get back into the workplace. So I think expanding that provision that's already there, and using the expertise that has been in place from other employability programmes is a really, really big part about being successful. My question, and it particularly interested perhaps in Jordan, what you've got to say about this, but the whole panel too. The other side of this is obviously encouraging employers and businesses to see the real value in taking on people in the over 50s cohort. Again, from the work that we do, we see how much benefit that provides in terms of interacting with younger workers, providing that kind of experience and perspective on the workplace that younger people don't have because they're at an earlier stage in the career. So what more can we do, and I say we as a society, effectively to encourage people to see the value in taking over 50s, particularly back into the workplace, which will hopefully obviously open up even more opportunities for that cohort that we're talking about. Thank you.
Thanks. And then we'll just take the gentleman in the third row and then the gentleman in the second row, and then I'll bring them back.
I hope you can remember all of these. My name's Theo Clay. I work for NPC. We're a think tank for the charity sector. And my question's about levelling up. So we know that around a third of the productivity gap between the Northern Powerhouse and London is attributed to ill health. And obviously the Health Disparities White Paper was meant to be one of the main places that this was going to get taken forward and this agenda was going to be tackled. But that was, of course, dropped last week. So my question is just about how do we make sure that the inequalities, regional inequalities in health remain at the core of government agenda?
I don't know if the government's actually confirmed that they have dropped it, so it might be interesting to see if the Minister has an inside track on that.
No,
Is it on? Yeah, hello. James from Cooperatives UK. A lot of our members are worker cooperatives, so these are businesses jointly owned, democratically controlled by their workers, and one of the key benefits of that model turns out to be well-being. The degree of control translating into well-being for the worker members. Now, clearly, not every business can adopt that model, but there are lots of good things that businesses could adopt. And I guess my question is, could more of the business support that gets provided through growth hubs and that type of institution more explicitly target helping businesses to adopt well-being enhancing work practices?
Great. Okay, so probably useful to recap for everyone here. So Laura asked a question around retirement, and do we need a sort of new taxonomy around how we talk about work, perhaps after 50? James around mental health and particularly interface with local authority funding. Lee asked about over 50. I think that links nicely around the sort of not viewing it as a catch-all, having specific strategies based upon workforce capability. Ian on levelling up. Are we still committed to that agenda? Is the government still on board? And then James sort of giving people control around well-being. Sarah, maybe if I come to you first.
Can I pick? I don't think I can answer all of those.
Don't feel obliged to answer them all, because otherwise we'll be here until 4 o'clock.
All right, fine. To your question, who wants to retire? I do. That is when I was a kid and people said, what do you want to do when you grow up? I used to say, I want to be retired. Because my grandparents retired and they seemed like they had a really nice life. I still think it would be quite nice. Okay, I'm going to take the levelling up question. Obviously, I don't know the answer about the government's priorities, but I agree with you that I think it would be a real shame and an abrogation of responsibility at this point if we stop paying attention to this. And it isn't really relevant to this particular question. So you referred to the kind of healthy life expectancy. I mean, the disparities in healthy life expectancy between lower income and higher income areas are huge and growing. Life expectancy full stop for women in deprived areas has now started to decline in this country. And you're getting to a point where because the state pension age is rising in line with average life expectancy, it's now starting to push above healthy life expectancy in some areas, which is just going to be a huge problem for people who aren't old enough to get the state pension and yet simply aren't well enough to work. So I would just reinforce your point that it's important.
Great, thanks. Jo?
Well, I think, to respond to a few of those, I mean, I think on the retirement point, as Sarah's saying, I think, not everybody actually has that choice because of the difference in health status. So there's a 16-year gap in sort of how soon diseases are diagnosed. If you're poorest women in the UK, you will have your first diagnosed disease at 60 and a health that's similar to a 76-year-old in the wealthiest part of the UK. So I think this, I kind of agree retirement, perhaps isn't the most useful way of thinking about it because very few people now are going to get to what we call the retirement age. People are going to be not well enough to work way sooner than that in many parts of the country, and that's just going to really be a drag on our economies in those places. So kind of takes us to the levelling up. It's absolutely critical that the levelling up missions are committed to by this government and that we have some really clear strategies in place around what they're going to do, particularly on the health side. I think one of the things we observed was we saw the levelling up white paper come out with a lot of fanfare and, a lot of goodwill behind it, I think. But the health side of it kept being said, well, we're going to have the health disparities white paper, we'll have and everything was knocked back into that paper. There's a whole queue of questions waiting to be answered in the health disparities white paper, and at the moment we don't know when that's going to come out. So I think the levelling up agenda is absolutely critical. I think mental health, this is the big gap in terms of the support that's provided to people in this country. We don't have the support in place that we need for people, both, as a kind of preventative model and then sort of the underfunding in services at the sort of more acute end. I think local authorities do have a role to play in some of the services they can provide, but we know they've had 70% cuts in their budget over the last 10 years. So I think, what we're starting to see now is a kind of fraying health because of the lack of investment we've seen across so many parts of our society in the last 10 years. And we have a choice at the moment. Do we continue to disinvest in the social infrastructure and the services that we need, in which case we'll see people getting poorer, sicker, fewer people able to work, and a diminished economy? Or are we prepared to make the investments that's needed?
Victoria.
So on retirement, I personally, I agree with you, and my dad's still working at 79. But I think we do have to recognise what Jo has just said, which is that not everybody is fit and well, and also that not all jobs are the sort of jobs that you can do when you're much older. So I'm very keen to promote the idea of not going from 100 to 0 when you retire, of the idea of slightly more flexibility and moving between jobs and careers during the course of your working life, so that there is something for everybody that wants and is able to do it. I agree with what Jo said, much of what Jo said about mental health services, which are clearly under enormous strain. And I think it is very important that we remember, traditionally, we all talked about people with MSK or bad backs being the people who were out of work. The nature of work has often changed. It might be possible to do it at home and on Zoom, and often different sorts of jobs are available. The new area that we're very concerned about who are not in work are those with mental health issues. And also at the younger end of the workforce, those with mental health issues who are not able to get into work in the first place. A lot of this, and a word I keep using to answer one other question if I can, is about flexibility. In fact, this slightly answers two, I think. So there are a group of people, very tight labour market, group of people who are close to work. And they come into a job centre and you offer them 3 jobs and they pick one and off they go. I mean, possibly a little bit more help than that will be needed. But you know what I mean, a group of people who have worked, who will work again, who know how it operates. There are also a far more complex and difficult to deal with group of people of all ages, frankly, who need much more bespoke wraparound care of the sort that we've provided in youth hubs and of the sort that we've targeted with, say, Kickstart or Restart. And what we now need to do in order to alleviate the tightness in the jobs market is to make sure that that bespoke wraparound care is available as widely as we can.
And just on that point, because I know that it was mentioned by one person in the audience and also Jo, in terms of the government's commitment to levelling up, and I guess disparities is within that. That's still there.
I was slightly trying to answer too many things at once, but yes, absolutely. A lot of work is place-based. Obviously, we work near where we live broadly, and it is absolutely so enmeshed with the levelling up agenda that we probably don't talk about it enough because it's just taken for granted within the department. But yes.
Jordan, would you like to come in, and then I'll see if there's any further questions out there.
So to take the lady's question first, absolutely. For me, I think a big challenge is people burn themselves out in their 20s and 30s, so their 40s and 50s, they're kind of lurching their way to retirement. So we need to kind of smooth that work journey out for more people so that they're not kind of front-loading it heavily, so that they need retirement when they get to their 60s, is a big point I think we should be making. And lots of employers definitely go down tracks about not having normal, pragmatic, human conversations with people because they're terrified of saying the wrong thing. So there's lots of things about language that need to be taken care of. To the gentleman in the middle, we can't talk too much about local authorities, but from a business perspective, the WHO says mental health is going to be the biggest leading disease burden cause by 2030. So we already know we're staring down the face of a gigantic mental health crisis. And so the vast majority of people only click in that this needs to be done as a kind of priority when they've had lived experience of it. They know someone who's had lived experience of it. So there's loads of brilliant campaigns out there, but we need kind of more action. I think we'd hold our hands up to say the CBI needs to be kind of pushing firms further down this journey to do more proactively. The gentleman talking about over 50s, absolutely. The vast majority of us will probably have to retrain at some stage in our career, and yet when we have the conversation about retraining for people over 50, over 40 even sometimes, For lots of people, this feels like too much of a lift. There's no way they're going to be able to do it. There's no way we'll find a job for someone who's been in the labour market for that long. We need to shift that, absolutely, because the majority of us will probably end up having to retrain at some stage. So we're all in this together. And on disparities, absolutely. I can't imagine the government wants to kind of not talk about disparities. I think we might be getting caught up on a single white paper when actually lots of the work we could be doing between government and business we can kind of just get on with doing, and the CBI is really committed to doing that. So that's a stab at most of them.
Yeah, I guess if white papers were always the answer to complex public policy questions, we'd have solved everything. We could all go home, couldn't we? Great. Are there any more questions out there in the audience? We've got a lady down here. Thank you, yes.
Thanks. Brendan Ryrie, Chartered Society of Physiotherapy. We really welcome your commitment to expanding and developing occupational health. Could I ask, therefore, the Minister, that you advocate for a healthcare workforce plan that includes allied health professionals like physios and physio support workers, both in the NHS and private sectors, because they're really vital to delivering rehabilitation to get people back to work, ensure that they live their best lives, and obviously to developing occupational health as well. Thanks.
Thank you for your question. Have we got anything else out on the floor? Otherwise, I will take chair's privilege and ask another. Was that a hand up? No. The one question I wanted to ask about is Dame Carol Black did a review in 2008 which looked at the relationship between health and work, and I think the evidence base then was pretty concrete and some of the interventions are well known. But a decade and a half has gone by without much progress, or not as much as we would like. So are we ever going to be able to shift the dial in a significant way, and what will it take? I guess it'd be good to get the final reflections from our speakers on it before we then close. So I will start with Joe, and then we'll work along the line.
I mean, just directly to that question, I think you're absolutely right. The work that allied health professionals do is vital to the kind of well-being, rehabilitation agenda, and really important part of the workforce. So I hope there is that investment. I think the sort of on the kind of, can we turn the dials? I suppose, it's really good to have a conversation that's focusing on work and health. But of course, kind of our health, our individual health is a product of so many other things that we experience, so it's about our early years, our start in life, it's where we live, it's the kind of food we eat, food we have access to, and which goes back to this point that this is a bit like, the climate change emergency, that you can't address the health crisis that we have in this country through one lever. So, Carol Black's report on work and health was a seminal report. It did lead, I think, to a stronger recognition on this. Maybe what we need are some equivalent reports looking at some of the other intersections between housing and health, through our food system and health, through transport and health, and start to really understand how all aspects of government policy can feed into that. And I think, the really positive development I would point to in the last few years, I think, is the CBI's commitment to this agenda, because we often look to government to solve everything, but in reality, what our employers are doing, the kinds of working conditions they create, but the kinds of products they produce, all of those things have a huge impact on our health, and they're an important contributor.
Victoria.
Yes, a very important point. As I referenced earlier with the occupational health discussion, part of the problem is the clinical availability of people with expertise in this area, and it is really important, and I will continue to work on ways to make sure that those are jobs that are attractive and are available to all different sorts of employers and the self-employed as well. I think this has been a really useful discussion. I think it is, the correct government answer would probably be to say, yes, the government is very interested in this because of of course, we want people to be healthy and happy across the board. That, I hope, very much is true. But I think as a secondary driver, the fact that the labour market is incredibly tight at the moment, and that we really need everybody who possibly can to be working, is also helpful, not least because it gets the employers absolutely signing up to many of the interventions that we know over the years have been explored and that work. So We probably don't need a report. I think we know what levers we need to be pulling. We just need to go ahead and with the good offices of our employers and good quality management, as Joe said, which I think is key, and flexibility across the board, we will probably be able to pull them.
Jordan.
So don't need tons more reports. I'm sure we could do brilliant reports with options in them for what to do. Firms, controversial for the CBI to say. Some businesses will need a nudge on this, and we're here to nudge them. Other businesses will just do this anyway. There's a growing conversation about the suite of corporate reporting, your Section 172 statement, being cognizant of the world as a kind of progressive employer. So there is an evolutionary role, I think, for the structure of corporate reporting and everything else in the UK to kind of catch up with the health element in the way that it's had to do with the climate element. But for me, I think if you really want to get your way out of this, we need to kind of get that balance between state and employer a bit better, a bit more clarified, so firms know what they're kind of personally responsible for. And then I think, avoid micro-regulation to get our way out of this. It needs to be a kind of big partnership over multi-years. And we kind of need to help people along with what they're reporting on, why they're reporting on it, and kind of just get them to start doing it. I think that's going to get us going.
Yeah, on the point about employers, in my job I talk to lots of employers and I talk to lots of workers, and what always strikes me is just the huge spectrum that exists between often big, not always big, very good employers, and really bad employers actually who treat their people very badly. The Financial Times where I work, we have a physiotherapist, on staff, and if anyone has a sore back, they can go and see them, or they'll come and check your workstation and make sure that you're not at risk of getting RSI. I mean, that's great. But there are lots of people who work for employers that can't do that, couldn't afford to do that. There are also, employers that actually take just a really punitive approach to sickness and ill health, who see it as a cost. They often assume that people are sort of slacking or taking a day off. A lot of employers, even some public sector employers, have sort of ways of scoring absence days, which are really sort of inflexible, which, I will always remember talking to an occupational health specialist in North Wales who was talking about a lot of the people that were sent to see her work in kind of manufacturing jobs, factory jobs, hard physical labour. And they were so scared of getting a sickness absence at work, which would lead to a disciplinary action, that they didn't even want to go to their hospital appointments. And so I think, as well as celebrating the great stuff that good employers do, we need to think about how to help smaller employers to just have a better approach to this. And it doesn't always have to cost a lot of money. There's also things about just the way you talk to people, the way you treat people, which isn't expensive, but I think would go a long way.
Great. We're up to time. So, and I know the Minister needs to head off to your job centre visit, which I hope is successful. I'm going to head to the main stage to read what they've got written on the two sides to know about the Prime Minister's commitment to this agenda. But I'd just like to thank our expert panellists and then also the Health Foundation who kindly delivered this event in partnership with us. So thank you.
Thank you. Nice to meet you.